Hi doctors, welcome back to the new episode of our A to Z series, where in each episode alphabetically we discuss one of the most repeated previous year topics of INI-CET, NEET PG and FMGE. And our today's episode is episode H, where H stands for HENOCH SCHÖNLEIN PURPURA. So let's begin our today's discussion with solving this MCQ. A 7-year-old female child is brought to the OPD with cramping abdominal pain. On examination, she is found to have rashes on the back of her leg, buttocks and the extensive surface of her forearms. Laboratory analysis reveals proteinuria and microscopic hematuria. What is the most likely diagnosis? Option A. Systemic lupus erythematosus. Option B. HENOCH SCHÖNLEIN PURPURA. Option C. Post-streptococcal glomerulonephritis. Or option D. Hemolytic uremic syndrome. So which option do you think is the correct one? Well, yes, option B. HENOCH SCHÖNLEIN PURPURA is the correct answer. So now let's move ahead and talk about the key features of HENOCH SCHÖNLEIN PURPURA. It is an IgA vasculitis. It's overall most common pediatric vasculitis. It is a mild type of vasculitis. The peak age affected in HENOCH SCHÖNLEIN PURPURA is 3 to 18 years. It can also occur in less than 3 years and more than 10 years as well. It rarely occurs in adults where it has a chronic course, and this is more severe. The males are affected 1.5 times more than female by HENOCH SCHÖNLEIN PURPURA. The clinical features of the infection occur after 1 to 3 weeks. So let's start the discussion of the clinical features. Let's begin with the tetrad. Skin 90 to 100%, renal involvement, joint involvement and GIT involvement. Now let's discuss these involvements in detail. First, let's talk about the skin involvement of this disease. There is a presence of rash, palpable purpura in gravity-dependent parts like the lower limbs and buttocks. It is bilaterally symmetrical. Subcutaneous edema may be present. There is a presence of renal involvement which includes glomerulonephritis. This indicates the presence of hematuria, proteinuria, edema and hypertension may or may not be present. Now let's move ahead and talk about the joint involvements. The presence of arthritis or arthralgia. It is of non-deforming type. This involves large joints, knee and ankle. This lasts for 2 weeks and then disappears. Now let's move ahead and talk about the gastrointestinal manifestations. Colicky abdominal pain is present. The other manifestations include first, melena. Second, intussusception. Third, vomiting. Let's move ahead and talk about the CNS involvement. It is also common. There is a presence of headache, increased intracranial pressure, seizures and altered sensorium. Moving ahead, now let's talk about the investigations. The ESR and CRP levels are increased, platelet count is normal, total serum IgA is increased, but this is not diagnostic. Investigation of choice is biopsy. Skin, leukocytoclastic vasculitis. In kidney, we have mesangial deposits of IgA, which shows focal deposits with endocapillary proliferation. Crescent formation is rare in children. Let's move ahead and now talk about the treatment of HENOCH SCHÖNLEIN PURPURA. More than 90% cases improve spontaneously with conservative management within 4 weeks. Role of steroids is only in severe gastrointestinal involvement. Oral prednisolone is given 1 to 2 mg per kg per day for 1 to 3 weeks. Steroids do not alter natural course of illness and does not reduce risk of HENOCH SCHÖNLEIN PURPURA nephritis. If the patient develops HENOCH SCHÖNLEIN PURPURA, then the mild to moderate cases are managed conservatively, whereas the severe cases require corticosteroids. So this is the appearance of the HENOCH SCHÖNLEIN PURPURA. Now let's end this conversation with the last question for today. So the question is, what is the recommended treatment for a male child who is experiencing joint pain and abdominal pain with the presence of palpable purpura on the lower limbs? The patient also has a previous history of upper respiratory tract infection preceding the current symptoms. Option A, azathioprine. Option B, observation. Option C, cyclosporin. Or option D, glucocorticoids. So which option do you consider is the right one? Well, yes, option B, observation is the correct answer. So that's all for today. Thanks for watching and see you in the next episode. And our next episode will be episode I. And yes, if you have still not liked this video or subscribed to my channel, please don't forget to do it. Till then, bye. Take care.